Well, I'm pleased to be here. I love to go ahead and see what structural energetic therapy has grown to and how it's reaching out to people, and possibilities opening up now for the people that are watching today. Structural energetic therapy is about getting people pain-free and functioning at a very high level. Now, it started off when I first started doing structural energetic therapy. People were coming to me in pain, and I had to find ways of bringing the body into a position or support that would allow the pain to rehabilitate the condition causing the pain. So rather than pain management, which I saw as kind of an obscenity, structural energetic therapy became a way of rehabilitating the condition that causes pain. Now, pain, mainly speaking about musculoskeletal pain, pain that's within the functioning of the muscles and the structure of the body. And one of the things I saw when I stood everybody up to look at them before I would start to address whatever problems they'd written down or told me about was that there was a spiral twist in people's bodies. And the spiral twist could be seen in a herniated disc, it could be seen in a whiplash, it could be seen in a migraine headache, it could be seen in acid reflux, it could be seen in plantar fasciitis, knee or hip problems. There was always a spiral twist. And people needed to get out of pain, and everybody was coming with a spiral twist. And I just wondered, when I looked at where the pain was taking place, it always was in relationship to this twist. So part of the rehabilitation became bringing the body out of the twist. So if we brought the pelvis into alignment with the rest of the body, then the spine could be straighter and the herniated disc would not have pressure on it. Or the curvature of the spine that was causing degenerative disc disease wouldn't be as exacerbated or as exaggerated, and consequently we'd have less curvature and we'd even out the pressure on the disc, and that degeneration would lessen. And closing off of the space that was pinching on the nerves would be less, so they'd have less pain. Well, this was getting a lot of interest from a lot of people. And one of the things I started doing when I was trying to understand this spiral twist on people was why other people weren't treating it. And what I found out was that other modalities saw this spiral twist as normal. And they didn't have a way to bring the spiral twist back into more balance. They'd work on part of it, but they wouldn't work on the whole thing from the top of the head to the feet. And what I found was I could work on the area of pain first and take as much distortion out of that, but then bring the rest of the body in to support the changes. So the work wouldn't be completed until, say, the feet were in a better place to support the shoulders, to support the neck. Now, when I got involved with cranial work, cranial osteopathy, I started studying that. I started finding some similarities to what was taking place in the pelvis or taking place in the spiral twist, what was taking place in the cranium itself. And cranial work at that time, except for very few osteopaths, was very light, very gentle work. But some questions started to be asked, and I was one of the people asking the questions. What would happen if we changed the articulation of the cranial bones to where they could align differently, move more fully and more balanced? What would happen to the rest of the body? One of our biggest problems we had was, they call it hip complex syndrome in PT, was where one hip would be anterior, one would be posterior, which is part of the spiral twist, but there would not be a support for the spine, a weight-bearing support for the spine. And that caused incredible amounts of difficulties with the spine, even migraine headaches and all. But we found this very spiral twist in the cranium, and it created a TMJ imbalance. So when I started using kinesiology to evaluate, we found everybody had a TMJ imbalance that had the spiral twist. Now, some people were having TMJ headaches, some people were having TMJ dysfunction where they were in a lot of pain, and some people were having a lot of invasive therapies on TMJ without ever getting the spiral twist out of the cranium, so there could not be an even opening and closing of the jaw. They were working on the muscles, they were grinding the teeth down. Some people even have the jaw broken and shortened or changed in length or size. But what they were ending up with was a bigger complication. because it still had to come back to it didn't have the levers of the movement for the muscles, the movement of the jaw. If that was uneven, it couldn't be even. So looking at all that, kinesiologically, we could test mouth open and people would test weak. Okay. Now, somebody coming in with plantar fasciitis had the same spiral twist. Somebody coming in with a cartilage in their knee had the same spiral twist. Somebody coming in with a hip that was degenerated had the same spiral twist. And they were all in pain. Now, I needed to rehabilitate the condition that was causing the pain. So looking at the cranium, it didn't take long for, okay, what would happen if we started to change what was taking place in the cranium? Now, cranial work to that point had been very gentle, like I said, very subtle work. What we were talking about was using myofascial release pressures to increase the range of motion and release the restrictions on the motion so we could bring it back into balance. And that was something totally new on the planet. No one was doing it. So going into that, we didn't know what was going to happen. But as we used the cranial work to do that, we suddenly got the whole body shifting back out of the spiral twist to the degree that a major part of the body started to have strength and balance that it didn't have before. So structural energetic therapy always was working with myofascial work to try to bring the body back into balance. Now we applied that to releasing the restrictions of the cranium and bringing it into balance. Now that came down and created a structural balance in the body that was previously not able to be attained. What this did was gave us a structure that we were guaranteed to get to rehabilitate into. So the pressure was taken off all these areas that were in pain, and there was structure and there was balance. Now, another part of it is we found out that when people were in this spiral twist, I'll now call the core distortion, because that was the name I gave it, because there was really no name for it. When people were in this spiral twist, 50% of the muscles in their body were operating at about approximately a 50% strength or efficiency or less. So a tremendous amount of their physical potential was not even available to them. And I'm talking about professional athletes that were coming to me, that 50% of their muscles were operating at 50% or less strength and efficiency. Well, when we started doing the cranial structural core distortion release, that's the name I gave the releasing of the spiral twist of the cranium, we could come back and use kinesiology and retest, and those muscles will be strong. Now, look at someone that had a shoulder separation, surgery to put it back together, and they didn't only have the weakness from 50% of the muscles attaching on the shoulder not working properly, which causes pain and dysfunction. They also had the problem with the scarring and the other misalignment that took place when they had the injury. Now, using the cranial structural core distortion release, in the very first session, we'd start to shift that back into balance, and we'd start to engage the muscles that could not engage to 70 or 80% strength and efficiency, which is better than it was before the injury, but also left the body in a point that it could maintain a structure that did not pinch on a nerve, did not strain a tissue, would take the strain off a tissue that was inflamed or being strained and compact or compressing on a nerve. All that would disappear. So now that shoulder had full range of motion, strength, and all the nerve compression was out of it. And the inflammation could be taken out when we come down and do the soft tissue. The adhesion of scar tissue would be released with the soft tissue work. Now we were approaching a more complete therapy, a more complete rehabilitation, and the pain was gone. So we can start saying that we can have our goal that you can resume normal life pain-free. Now, when we started doing this in structural energetic therapy, we were looking to get people out of specifically structural pain. Some of the things that came about, though, was congestion migraines, where people had migraines from buildup of cerebral spinal fluid inside their head that pressed on the cranial nerves. Very severe migraines. And so when we started doing this, we had a greater range of motion of the cranial bones, and we found that we could actually pump out that congestion. so we could compress the cranium and pump it. Now, I started doing this about 2000. About 2011, Dr. Nettergaard at the University of Rochester discovered a new system that totally explained why this worked, and it was called the Glymphatic System, which is the principal way that you release and pump out toxins from the brain. Also, it provides a lot of nutrients and a lot of nutrition to the brain. Now, this had previously been an unknown system, and it started to show up in things like any sort of brain diseases and things like Alzheimer's and dementia. But this glymphatic system also showed up as being an answer to people that had anesthesia dementia. After having anesthesia, especially the elderly, oftentimes have dementia for up to 6 months, sometimes never fully regaining their full acuity, mental functioning. But if we could go ahead and use, by getting a greater range of motion of the cranial bones and then use this pumping motion, we could pump that glymphatic system and we could release that anesthesia that had gotten in the brain that the old system had gotten inefficient at working with, and that they wouldn't have that anesthesia dementia. Now, this also went over to work very effectively with autistic children. It also works as a preventing Alzheimer's because we're pumping out amyloid beta. And it also works to restore the brain after concussions. And I'm not going to go into that at great length, but there's a tremendous amount of restorative work after concussions that can be done that is not being done anywhere else. And people don't have to go through the rest of their lives with a less functioning brain because it can be restored via the glymphatic system on that, all because we got greater range of motion and then learned how to pump it. So once again, that's not exactly pain, but that's very important. Now, one other part of this is homeostasis. The brain needs to be at homeostasis for almost any degree of health in the body. When you get a buildup of amyloid beta or other waste products or tau product or heavy metals or candida albicans or any number of other things that happen to the brain, then you can do a tremendous amount of other therapies and they're only minimally effective. But if you can bring the brain back to functioning at a higher level by bringing the glymphatic and also the lymphatic system of the brain, which is accomplished by that pumping, then it sets people up for any other form of therapy they're doing to be a lot more effective because you have the brain functioning at a high level to integrate with whatever therapies you're doing. So that was huge. Now, we start looking at headaches. Headaches have to do with oftentimes with structure, oftentimes with the structure of the cranium where it's putting pressure on cranial nerves, oftentimes with the imbalance here that's repeated in a high-low shoulder, which comes back to the tops of the shoulders and the tension and stress there. Oftentimes to the way the occiput is sitting on top of the first cervical vertebrae, which actually presses the cervical vertebrae forward and causes a compression on the nerves in the spinal column as it comes through. The brainstem comes down through the occiput down into C1. We'll actually have a compression there. Some of the most severe headaches and most pressing headaches come from that. Then we get the bruxing, people that grind their teeth, that tend to irritate this. But once again, we take the balance out, bring the balance in, we take the tension out of the jaw and all, the bruxing stops. Now, there's one other thing that goes with bruxing, and oftentimes it's anger that people are expressing. So within the work and the release of the soft tissue, there's also emotional energy that releases. We see the name energetic in structural energetic therapy, and that's because our bodies are nothing but energy, and we're working in transforming and moving energy. But we're also working to release things that are binding up energy flows, which once again relates to pain and also relates to overall functioning of the body. So structural energetic therapy is really aiming to bring that into balance. And when we do that, there's a transformation in the body. That the structure comes in, the body's no longer in a structure that supports a painful condition. Now, I mentioned a few painful conditions that may seem strange to people, like carpal tunnel. Well, carpal tunnel comes from a structural imbalance that comes from the shoulders, one being high, one being low, and an internal rotation, which presses on the brachial plexus that will run down all the way down into the hand. Now, surgically, they like to cut right here and release the retinaculum that compresses the carpal or the median nerve that comes through the carpal tunnel. But if this nerve being compressed up here, or down along in here, or even up in here, then this surgical cut is not going to be effective. Yet they evaluate it by evaluating what's taking place at the fingertips, the nerve innervation at the fingertips. Structural energetic therapy works like, one, we change the structure with the cranial root. Two, we work to change the structure by doing myofascial release to take the structural shortening of the tissue so it can go ahead and balance more, even more than what the core distortion does. And three, we start working on the nerve compressions and the adhesion buildup and the scar tissue that's all working to compress nerves all the way down and through. So it could be carpal tunnel, it could be a wrist problem, it could be an elbow tendonitis or chronic irritation at the elbow or shoulder, fasciitis or rotator cuff or whatever. But when we do this, function returns and the pain goes away because we've taken so much out of it. Going down the body, if we take a look at acid reflux, everybody thinks you have to take some sort of antacid and that's your answer. But the bottom line is in the core distortion, your rib cage is tipped with a spiral. And the diaphragm muscle, it has a little round esophageal hiatus valve into the stomach, is being pulled to one side. So this little round sphincter muscle valve can no longer close properly. When we release the body structurally, we take the pressure off the diaphragm, we come in and release the adhesions that are built from being in that position for pretty much all of your life. And then the valve can function the way it's meant to, so the acid reflux that keeps going on disappears. The other thing is the vagus nerve, where it comes across into the stomach, is also released. But it's also released up under the occiput, it's also released through the shoulder, it's also released where it comes down and comes across to the stomach. So that vagus nerve no longer stays hyperactive. And so a lot of the ulcer pain and nervous stomach pain, and that goes away. Now we get to what's taking place in the abdomen. A lot of the gastrointestinal things that are taking place come from a shortening on that right side, where the right will be shorter on the core distortion, which causes a folding over of the colon. And when that colon is folded over, it's almost kinked on some people. Proper digestion can't take place. Things can't move through there the way they're supposed to. The stomach's compressed, the gallbladder's compressed, the liver's compressed. All that's being worked against. So a lot of the painful things that people have in digestion or in processing food, and that is from that. So as we bring that out, a lot of that starts to straighten out. Now, let's also start taking a look at surgeries at this point. People that have surgeries, especially abdominal surgeries, that are still in pain, have a lot of adhesions. Again, the adhesions formed when they had the surgery and after the surgery when they were in core distortion. So they're helping maintain this imbalance, and they're also working against the functions of the organs in there. When we go ahead and start changing the structure, we also have to come in and release those adhesions with soft tissue. And in so doing, we're going to allow the whole thing to shift. We're going to allow those adhesions to come off, and the pressure it's putting on those organs goes away, and we get a higher level of functioning out of the organs. This can come all the way down into the pelvis, into the bladder, into the pressure that's pushing out, especially after hysterectomy. Women's organs are being pushed out of their bodies because there's nothing to support them. We can bring that back in, and we can create the floor of the pelvis to support the organs inside the body. The pressure around the prostate on men is extreme. Oftentimes, no one ever thinks about how can we affect the prostate, but this core distortion causes tension in the floor of the pelvis that definitely affects the prostate. And as we work in there, we can change that. So a lot of chronic prostate problems that couldn't get better with even good therapy can now have a chance to work because we take off some of the tension, stress, and what's actually compressing on that prostate and holding it in a non-functional way.
Don, I just want to give you your 20-minute heads up. I know you asked for it.
I think it's really interesting if we take a look at hips. One hip is rotated anterior, one is anterior. Either way, the socket is not in the right place, so it's rubbing along and slowly but surely degenerating some of the cartilage. If we can shift the hips back and shift the head of the trochanter into balance with that, Even people that almost have no cartilage in their hip can avoid having hip replacement and return to a normal life activities pain-free. It's huge. After people have had hip replacements, they're still in the core distortion. And so a lot of the problems they have for their hip replacement being effective, causing pain and also causing adhesions, can also be released. Going on down now into the adductors, the insides of the legs, we can release that. That allows the whole lower part of the pelvis to go into a more functional balance that takes place, helps with sphincter muscles of the pelvis that help a lot as people age. And then we get to the knees and all the problems that people have with knees. Again, we're looking at bringing balance to those knees so that the knees are balanced the way they're supposed to instead of imbalanced. So we're not pinching the cartilage, we're spreading the tension out evenly. And that's going to take the pressure off, which is going to take the pressure off the areas that are thin, but also going to allow normal functioning pain-free. Okay, going into the lower legs, I've spoken a little bit about plantar fasciitis. There's neuromas. There are a lot of other arch issues that people have that can all be corrected. And that's all pain in the feet and all that, that once again gets better. Now, what's really interesting is the core distortion. When I talk about the core distortion, it's like, how do you see it? Well, one way you can see it is if I go ahead and use kinesiology muscle testing. It's not like you have to see it in the body, but I can show it to you in a person using kinesiology, what these weaknesses are and how we can evaluate it. So that's what we're going to do now. I'm going to have Barry, my assistant, lie on the table, and I'm going to test him. Now, Barry's already had the core distortion done, but I'm going to have him test weak, go weak, as if he hadn't. So it's at least a demonstration of what would be weak if you had the core distortion. And then I can go ahead and talk about that more. So we're going to have Barry lie on the table. And I'm going to come over here. I have to move it back just slightly. Okay, we're losing part of the show. Okay, so we're going to tip it up slightly. So, kinesiology that we use to evaluate the core distortion. I bring an arm out straight from the body, turn the wrist down. I want to isolate a single muscle, and I have Barry resist when I press down. That's strong. Now, there's a challenge point that'll give me a weak if I press right here, and that'll go weak. So that means he's testable. Now, if I was checking Barry for the core distortion, I mentioned the TMJ in the mouth. That's the most common weak test we can get. So I'm going to have him open his mouth wide. And if he's in core distortion, that's going to be weak. Close his mouth, that's strong. Now, if I want to go ahead and check what some of the bones of the cranium are doing, especially the sphenoid, I'm going to have him turn just his eyes to the left as far as they'll go. That'll test weak. Eyes to the right, that'll test strong. Now, to go ahead and go a little further, if I want to check the occiput, which how it sits on the top on the spine in relation to C1, I can have him turn his head away from me as far as he can. That'll test strong. Have him turn his head towards me as far as he can. That'll test weak. So that would show that his cranium is in the core distortion. Now, any new client that comes in, this is one of the first things we do after we stand them up and take a look at the structure. We're going to lie them down and test them because we need to get rid of this core distortion, which really separates structural energetic therapy from all other therapies because we're the only ones working with it directly. The next thing I'm going to test is his leg strength. And this is where it gets very telling. If I have him hold his right leg up and test it, it's strong. If I have him hold his left leg up and test it, it's very weak. And at this point, I'll ask him, is that 50% weaker than the other leg? And usually it's more than that. Now, that was his left leg. That's because his left ilium is rotated anteriorly with that core distortion. I have him come onto his stomach. And if I'm going to test, now this is now his left side. This is the back side of that left hip. If he brings his leg up, holds his leg up, and resists, it's strong. His right leg that was strong on the front, if he lifts his leg, will be weak. Okay. Now, at this point, Barry not only is becoming aware that this goes from the top of his head down into his body, but it would start to explain why he was having problems with, say, lumbar vertebrae, or sciatic pain, or plantar fasciitis, because now we're getting down to his legs and feet. Now, if he comes onto his back, I'm going to do some more tests. And one of the reasons I do these tests is to show the client what we're talking about 50% of the strength. If I check on top of the right leg, it'll be strong. If I check on top of the left leg, right above the patella, it'll be weak. If I check the medial aspect of the attachments of the muscles of the right knee, it's weak. The medial aspects on the right knee is strong. If I check the lateral aspects on the left knee, that's weak. The lateral on the right is strong. If I check the posterior attachments on the right knee, it's weak. The posterior on the left, it's strong. But what we've just seen is 50% of the muscle attachments on both knees, even though they're different, are weak and not able to stabilize a joint effectively. Now, I can spend the whole day testing somebody, and we would find that for every joint in the body. I've done that before. Now, if I'm working with a client, though, and I want to show them that it goes down to their feet, so I'm going to test the medial arches, and on the left, the medial arch will be weak. On the right, the medial arch is strong. If I check the lateral arch, on the right, it's weak. On the left, it's strong. So right now, I have a whole bit of information that I've picked up that verifies the core distortions here, that tells me that bringing him into weight-bearing support, bringing his core distortion into support is going to be part of the rehabilitation that he's really going to need for his neck pain, his headaches, his sciatic, his hip complex, plantar fasciitis, whatever, that I can start with the cranium. Now, I also have a before and after. So after I do the cranial structural core distortion release, I'll just show you my hand placement only for a brief period of time, because it's not very good for showing on camera. But I would hold the occiput and the sphenoid, and I would take it through its ranges of motion, releasing restrictions that I found. Then I would come back and I could retest. And retesting, I could get the strong first, have him open his mouth, strong. Have him turn his eyes to the left, strong. Eyes to the right, strong. Okay, that's all changed. So now we see we had a significant change in the very first 15 or 20 minutes of session. Now, it's really amazing when I go ahead and have to test his legs again. Okay, this right was strong, it's still strong. This left was weak, and now it's strong. Now that's going to bring a lot of amazement to start with. If I hadn't come onto his stomach, I can check now. This is his left that was strong, so then bring it up and I check the backside. It's strong. His right that was weak, check it. Now it's strong. Okay, so let's say he was having a hip problem. He's already seeing a major change directly in the problem, but he's also picking up that something is happening in this work, that there's now hope for his rehabilitation from this problem. Many of the clients that come to structural energetic therapy have seen innumerable practitioners around the country, had many surgeries, had many interventions, and it hasn't solved the problem. The core distortion has not been addressed, brought back into weight-bearing support, and so they won't get so much better. So this is the first thing we do in structural energetic therapy. It sets us apart from all other therapies, is we use kinesiology and the cranial structural core distortion to bring the body into balance, and the client gets to see a change almost immediately. And so the client that's given up hope, they've been everywhere, nothing's worked, now has a chance and knows they have a chance for good rehabilitation. All the pain might not be done until we do 5, 6, 8 sessions, but they see a change from the very beginning. And I can explain why they were having the pain they were having and what we're doing. So there is a solid protocol, a solid plan for how to get them better. Now, the other part of this, though, is soft tissue doesn't just go ahead and go according to my plan. Everybody's soft tissue responds differently. So what we go to now, after we've done the core distortion release, is we go to myofascial release, where we're working directly with the fascia to separate, stretch, and reorganize it. We're going to take away the myofascial holding patterns. We're going to release the buildup of waste products in the muscles and the inflammation products. We're going to go ahead and take the scar tissues and nerve impingements and soften those and normalize those and release the pressure they're putting on the nerves. And we're going to allow the body to even go further into balance, because after you do the core distortion release, it's trying to go back into full balance, but the restrictions in the fascia prevent it. Now, what also works on people is people have held back emotions their entire life. This is part of our culture. We don't always express all of our emotions. And we found places that are easy to block emotions are some of these areas that are chronically tight from the core distortion release. So as we start to release this, and we're releasing the soft tissue, we're releasing chronically tight muscles that block emotional energy that's not been expressed from the body. So within a session, a client may be encouraged to cry or laugh, always encouraged to breathe, which allows that energy to move through the body, or even have a temper tantrum if the anger comes up, but then direct it into the table in a safe space. Once the emotion releases, and we have the structures in the soft tissue and in the structure from the core distortion release, there's been a full transformation in the body. And at that point, we can say we're really approaching a full rehabilitation. And we're looking at a long-term rehabilitation that they can go back and resume their normal life activities pain-free. Now, if they were coming for homeostasis with the brain or a concussion or something like that, we're going to work more with the head to go ahead and do some of those other things I talked about, the frontal occipital decompression, the pumping of the brain using the glymphatic and lymphatic systems that will help recovery from concussions or migraine headaches or toxicity of the brain or some sort of amyloid beta issue leading to Alzheimer's or dementia, anesthesia dementia, things like that. We can address any number of other things. A lot of children with learning disabilities and autistic children have shown great improvement after. The concussions, we're having tremendous results on getting people to recover fully from concussions where they may have spent 6 months of headaches, unable to think in a dark room. We're seeing some really amazing things happen. What's also true about concussions that's really difficult that is not being addressed is that the longer the glymphatic system that's supposed to take the waste products out, and will take the damaged cells from the concussion out, the longer it's not able to function, the more buildup there is, and the more likelihood of an onset in 10 or 15 years of dementia or something that the person wouldn't have otherwise. We see this with professional athletes all the time. Now, we can test for that and find out that's going on with somebody because a lot of people have undiagnosed concussions that we can deal with. So we have all sorts of tools. Thank you. Kinesiology has given us a tremendous way to evaluate and see problems both before and see that we've corrected them afterwards. It's one of the very valuable tools we use in structural energetic therapy. Okay. Are we ready for questions at this point, or should I keep talking?
Yeah, we're ready for questions.
Okay.
If you're open to it. So the first question I had, and you've touched on it a bit, Don, but how is structural energetic therapy different from myofascial release therapy?
Okay. Let me put it this way. Myofascial release therapy is used in structural energetic therapy. More specific, more directional myofascial release because we are working to a specific structure. But Myofascial release therapy does not have a core distortion release, does not create a structure to rehabilitate to. Structural energetic therapy is all about creating that structure. And we have the tool that the other therapies don't have, which is the cranial structural core distortion release. That is extremely effective in starting and bringing the body into structural balance so that the body's trying to release in the direction that the fascia is trying to go. It's already in, we're working with the body trying to get there. And the others don't have that. So there's a randomness to it. A lot of times, if we haven't released the cranium, the body's resisting what we're trying to do because maintaining what's taking place in the feet or in the head or different places. When we release that, the whole body starts to unwind, and then we can be like 10 times more effective with the myofascial release aspects of it.
Great. All right. So just to say it back, yes, some of these modalities are common, applied elsewhere, but you put them together in this way, in addition to also that cranial release, which adds an entirely different component.
Correct.
Yes. Okay. Another question: has structural energetic therapy helped people with Ehlers-Danlos syndrome and or craniocervical instability or POTS?
It's helped a few with that. I can't guarantee that's a rather complicated system, but it has helped some. It would be something I would try, but I wouldn't say absolutely we're going to get results. But anytime we start bringing the functioning in the cranium back, we start seeing some changes throughout. And the balance with the cranium allows the cranium to function at a higher level for a long time afterwards. So I would say it can help, but I wouldn't guarantee it's going to solve the problem. There's some other issues there that might not be addressed.
Sure. Another participant asked, does it help traumatic brain injury?
Absolutely. The traumatic brain injury, there's a lot of things that happen. I'm going to move the camera a little bit so I'm in front of the camera again.
Sure. And at this time too, I'd welcome if you have any questions or if questions come up again, please just, you can record them in the chat box. I'll be happy to pass them along.
Okay. First off, cranial bones jam more from being hit. So that's part of it. It's going to prevent some of the functions that work from the movement of the cranial bones. So that's one thing. Secondly, we get swelling in the brain that can't be pushed out, can't be moved out because the glymphatic system gets collapsed. Thirdly, we get a lot of damaged cell tissue. And because of the further imbalance of the brain, because of the imbalance of the cranial bones, we get strains on the neurons, neuron strain, axonal strains, that will eventually create chronic inflammation. Okay, all of these things, one, we're mobilizing and balancing out the bones of the cranium, which is going to allow the reciprocal tension membrane and the falx cerebri and the tentorium, which is a sling that the brain hangs in, to balance back where it's supposed to be. It's also the part that all of the major glymphatic vessels come through. And so it's going to take the pressure off those and allow those to once again open up and function. And third, it's going to allow the petrous ridges on the bottom where the tentorium comes in to support the tentorium back. So instead of being collapsed down here and cutting off the jugular foramens and the drainage of the brain, it's going to allow that to open back up. Now, these are all complex things I'm talking about, but they're things that are necessary in recovery from traumatic brain injury. Okay, so when we get to that point, from the cranial structural core distortion is going to work on that. We're then going to have a range of motion of the cranial bones in balance so the body can do this after we've done it. We're going to compress the cranium with the frontal occipital decompression to allow that cerebral spinal fluid to reinflate some of the compressed vessels of the glymphatic system. So they're going to reinflate, and when they reinflate, they're going to start taking away that buildup of waste products, the dead cells from the concussion, the blood, whatever's left in the brain that needs to be taken out, plus the accumulation of what's ever happened since then, which is also going to allow that chronic inflammation to go down. Now, all of that was working against the brain functioning. Now, that's kind of a quick overview of what takes place, but we cover the things with the vagus nerve not functioning properly. I mean, one of the biomarkers for traumatic brain injury is heart rate and what's taking place with that. And you can literally see a difference in change very quickly when you start doing this.
Mhm.
I use it in combination, so I don't see one separate from the other, the cranial structural core distortion release and the frontal occipital. And rebalancing the temporals, that's huge as far as bringing the vertigo aspects of traumatic brain injury back out. Working with, well, the occiput relates to C1. You can't get hit in the head hard enough to cause a traumatic brain injury. You still have the head sitting straight on the occiput and C1. It just isn't going to be doing. Bringing that back into a line so you take pressure off the brainstem. Now, these are all huge things as far as the headaches, as far as the vertigo, as far as light sensitivity and different things, and the inflammation going down. It's like all these are things that basically medicine doesn't have much answer for, doesn't do much with. If you're not hemorrhaging out, they can't take the pressure off by drilling a hole in your brain. They can't do a lot about traumatic brain injury. This is manual therapy that directly addresses.
I have another, oops, sorry, Don, I didn't mean to cut you off.
No, that's fine.
I do have another question related about the condition. Can it help those suffering with symptoms associated with psychotropic drug off tapering?
Okay, so suffering with symptoms, so that's ongoing symptoms like flashbacks and stuff like that? Or just the fact that they've got the drug in the brain preventing functioning of the brain?
Let's assume it's
Either
that.
way, as we release and pump that out, we can pump out the accumulation of that brain in the fat cells of the brain. That's handled by the glymphatic system. And if the glymphatic system isn't operating at a very high level, it can get overloaded or it can not function at all. And we can restore that, and then we can use that system to pump that out of the brain. Especially with things like anesthesia and stuff like that were extremely effective.
We have some great questions coming in. So thanks to those of you who continue to ask these questions. Kind of building from what you've been speaking to, is the cranial work, like the pumping that you are speaking about, self-administrable? Is there other, and then secondarily, are there other things that you would encourage people who have undergone SETT therapy to do on their own to sustain the momentum?
Okay, let's go with the first one. I can try, but I'm going to look kind of weird, and I'm not going to have the sensitivity of me working on somebody else. It's very hard to do that. So I would say basically you need to go to a therapist for the frontal occipital decompression. And you need to go to a therapist for the cranial structural core distortion release. You have to understand that that allows a range of motion that's not normally in the cranial bones, which allows the frontal occipital decompression to be so effective. So I'd say you have to go to a therapist for that. Now, the second part of that question was?
Really just asking, once someone leaves an appointment with a therapist, are there things that the patient is advised or encouraged to do to sustain kind of this new plateau?
So what we run into here is where the patient is in their recovery, in their rehabilitation. One of the things we say is before they can maintain 2 weeks pain-free between sessions, it's probably better not to stretch or do some things like weightlifting or trying to strengthen, because they tend to pull their body back into their old patterns. Once they can maintain for 2 weeks, then some gentle stretching or gentle rehabilitation works. One of the things I've run into with rehabilitation and strengthening is, say we have a shoulder that's been separated, and we bring it back and we get everything working pretty well. But there are some damaged fibers in there. And I kind of liken those damaged fibers to where you have 1-inch steel links of a chain held together by a paper clip. And you have to start strengthening according to the strength of the paper clip, or you'll tear the paper clip, you'll damage the paper clip. So I really hesitate to give people a lot of strengthening exercises so they really show they can maintain what they have. And then I give them minimal exercises because they tend to overdo. And when they overdo, the damaged tissue that's just now starting to function doesn't have a chance. It gets re-injured. And so I try to keep them back in situations where they actually had torn things or whatever. I'm saying probably till they can maintain for 4 weeks of structural energetic therapy. It's not a good idea to do strengthening. Now, for lumbar in the back, a lot of people will give them some, after 2 weeks, we give them some gentle leg raises and stuff like that to start strengthening the intrinsic muscles that stabilize the spine. That's really important. But once again, they're easy, gentle exercises. I like Pilates therapy. I like some of the yoga therapies, but only if they give them in what's appropriate for the injuries and the rehabilitation that's taking place. And so often they try to push them to go further than what they should be going, and they restrain them. So I have to go by the individual person. Now, after a session, if somebody comes out and say it's their first or second session, their body's dumping a lot of toxins. There's been toxins locked in their body from the chronic holding patterns and from muscles being in spasm, all this stuff. And so what we can oftentimes suggest is things like far infrared saunas, hot Epsom salt baths. Even the Beamer has been known to go ahead and pump more of the toxins out of the body. So things like that are good integrative therapies. I have the Beamer and a far infrared sauna in my office or in my clinic here.
Okay, very good. Someone asked the question, have you ever documented the efficacy of SETT with MRIs or X-rays to show more tangible and long-lasting results?
Okay, one of the things that we have a hard time doing with SETT, because we're not medical, we're not working in medical clinics for the main part, is the MRIs and the X-rays. They're expensive, and people, when they're out of pain, don't want to go back and get another set of X-rays or MRIs. We have had some scoliosis people that we've seen some really major changes on the MRIs and X-rays, and that's really neat that takes place. We're building up information. My position with SETT has been find what works and apply it. And if I can get someone out of pain, that's what counts. It's not having all the research in there. People following up now, we have a couple of research projects in the beginning that are starting to be done now, and hopefully the people that are doing those are going to continue, because we're getting at the point that it'd be really nice to have that documentation behind us and the research behind us. But we've really been more interested in getting results right in the here and now rather than spending the time on and figuring out the process. When I did the cranial structural core distortion release for the first time, I got a body that was different than anybody I'd ever worked with. I didn't know there were 24 sub-patterns the body could go into. So there's other cranial work that for any restriction of a cranial motion or of a lesion between or whatever, there's a pattern that the body can go into, soft tissue throughout the whole body. And to fully release it, you have to release the cranium and then go back and do the pattern. That took about 5 to 10 years to fully develop that and perfect that, because we've never seen people that weren't in the core distortion. It was like we suddenly had a new body to play with. Now, what's interesting is that new body was more evolved, was not going to degenerate in the same ways that a body that hadn't had the core distortion was. Some of the children I've worked with are doing extremely well in school and their concentration and stuff like that. So, and their coordination, if I get babies and work on them, their coordination, they walk sooner, they do things sooner, because they can manipulate their environment more because they have more control of what's going on. These are all things that in the future, hopefully we're going to have good research on. Like I say, we're relatively new. This has been developed by me, and then just me developing the training and getting the training out and getting people trained to seem to be the biggest pressing job I've had.
Yeah, I will say, so for those of you who may not know, we have a small scholarship fund that we operate or oversee here at the Marian Institute called the Mary Shands Scholarship Fund. It supports people who are seeking biomed care and need financial assistance. And we had a young person, I believe this person was 13 years old, who suffered from several different conditions and was nonverbal, who had severe scoliosis. And the money that this person received, this financial support, enabled this young person to receive SETT therapy. In fact, it only went towards SETT therapy treatments. And I recall the mother of this young person conveying that the doctors reported just absolutely remarkable change in the curvature of the spine after subsequent sessions. And I think they had only been going for, let's say, 2 or 3 months. It was not a great deal of time, but nothing else had achieved what SETT therapy achieved. So, you know, from me to you, that is something that I've become aware of just through interacting with this particular family. And it really blew me away. So, but on that note, you know, one of the questions another participant asked, and it's one, you know, I've talked to you, Don, about is, how do you find a SETT therapist? And are there many out there at this point in time, given that this is a relatively new modality?
Okay. We have a website, info at structural energetic therapy. No, structuralergetictherapy.com, excuse me. And you can go on there. We have Find a Therapist. Hopefully it's going to be working. It's like I'm not a webmaster, and it works sometimes, it doesn't work others. We're always calling up the webmaster to correct something on it. But we're also in the process of putting a whole new website in. It's going to be even better in the future. So that's one of the ways that people can contact therapists around the country. If you can't find a therapist, you can always call our office here, and we can go ahead and look at the list or call and talk to you about it. Unfortunately, we've only got about 200 people that are trained and fully trained right now that are still practicing, and some of them aren't doing just structural energetic therapy. So I can't always tell you who is and who isn't, but on the list you can find people and you can call and ask them. And hopefully they're doing structural energetic therapy.
Yeah.
COVID has put a big dent in the number of therapists because they stopped practicing for a while, and some of the states haven't allowed them to open their clinics back up and stuff like that.
Yeah. And the clarifying question is where is here? And that's again, the structural energetic therapy, that's Don's organization. All the information can be found there. And Don, I'm assuming that when you train someone and they go out into practice, that's how they end up on that list. Is that right?
Correct. They have to be fully trained to be on the list.
Okay.
They have to be able to get the core distortion release from the body, both from the cranium, the soft tissue, and energetically for any blockages that would be. Great.
And, to follow up, let's stick with this theme of speaking to kind of the patient experience. How often would you recommend kind of the average it sounds like pretty much everyone experiences the core distortion. So I take it that everyone could benefit from this therapy. And then at a baseline, what would be kind of an average frequency at which someone would see results?
Well, let me talk about, first of all, somebody coming in pain.
Sure.
If they're coming in and they're in pain, then I would say come weekly until they're not in pain. Then after they can maintain pain-free for a week, we go to 10 days. And then after 10 days, we go to 2 weeks. After 2 weeks, 3, and 3 weeks, 4, and after 4 as needed. Now, if somebody's coming for, let's say, they have a concussion, then I'm going to see them weekly. We can test for the concussion until they can maintain a week being tested. Then I'm going to go to 2 weeks, then I'm going to go to 3 weeks.
Mm-hmm.
After 3 weeks of maintaining with everything still testing, functioning high in the brain, then they're okay. If somebody's coming with just wanting to maximize their potential, say an athlete that wants to be able to perform at a higher level or something like that, I'm going to say come for 4 or 5 weeks and then come every other week. And when you get into your sport and really start pushing it, come every other week for a while to pick up whatever injuries or whatever are taking place from actually training your body. Because if you train your body and you maximize it out, you find the weaknesses, and then we can go ahead and work with the weaknesses that are still there.
Great. And similar to that, talk about insurance, because it's a question we often get with practitioners who, are practicing in new modalities or outside conventional care. Does insurance cover CSETT therapy?
It depends on who the practitioner is. And what state you're practicing in, what the insurance laws are in that state. Generally speaking, in Florida, I can speak of, it will cover, if there's insurance covered in the policy and it's prescribed by a physician, it will cover part of it. What they want to pay is what's reasonable and customary for a normal massage. This is not a normal massage. So there will be the cost of it. The training for the therapist is much more highly trained. They deserve to be paid more than just a beginning massage therapist. So hopefully that'll cover. Now, sometimes auto accidents, you can get involved in that and get the whole thing covered. Sometimes you get put onto a promissory note that gets paid 5 years later at 10 cents on the dollar. That's the way the legal system works. And sometimes in PIP, it'll pay it all up till the PIP runs out. It's like, I don't know. Every condition is different. The way we work in my office is people pay for the session, and then they go ahead and we'll help them file the insurance to be reimbursed. Because we don't want to put the price of the session to include all the time spent on the phone and trying to track our money down and have a full-time person just doing insurance.
Yeah. Yeah.
That's how we have to come out of what the people pay for the session. We'd rather not do it that way.
Sure, understandable. And yeah, and I think you mentioned this actually as we were speaking before. It sounds like you do have some set therapists who are also maybe trained in chiropractic care or kinesiology or other modalities. Yes.
And the greater your credentials, the more likely you are to be covered by insurance. And of course, a lot of insurance coverages created writing on how they like the form and describe the therapy and what they do, what codes they can put to it.
Yeah.
For the average massage therapist, there's only certain codes they can use. For a nurse practitioner, there may be more. For a doctor, an MD, or an osteopath, there's a lot more. So it really depends on who's submitting that. Now, some people are working in doctor's offices, and the doctor's office files it as the doctor does the work, and they get that covered more often than not.
Yeah, very good. I just know we're coming up on time here, and this has been hugely informational, and we appreciate, Don, you taking your time. So I'm going to go ahead and begin to wrap up. Next month, on January 4th, we'll be joined by Dr. Farney from Biologic Center for Optimum Health, talking about balancing the immune system. We hope you consider joining us for that event. And again, for those of you on the call today, a reminder that 1 week from today, you will receive an email from us with links to a recording from today's call, audio, and notes. And we'll include some additional information to put you in touch with Don and his colleagues at Structural Energetic Therapy. Don, thanks again for joining us. We're very pleased to have been able to have you.
Thank you for the opportunity.
Have a great day.
You too. Bye-bye.
Bye now. Bye all.